Hello! Welcome back to Vertical Movement PT. I'm Dr. Kimmi, physical therapist, and today we're going to go over an exercise and stretching routine to help reduce the risk of getting carpal tunnel syndrome, or if you already have it, to help reduce the symptoms that you're experiencing. All right, here we go. What is the carpal tunnel syndrome? Carpal tunnel syndrome is when there's compression in the carpal tunnel. The carpal tunnel is consisted of the transverse carpal ligament, and on the bottom, it's made of the carpal bones. So as you can see, it makes a tunnel. What runs through the tunnel are the forearm muscles, the tendons run through it, as well as the median nerve. So compression of the median nerve is what causes the numbness, tingling, and pain that you feel in your hand. If you're not sure if you even have carpal tunnel syndrome, there's a few tests you can do to see if that's a possibility. The first test is called the Phalanx test, and what you're going to do is grab both of your hands, place the back of your hands together, and hold this position for 1 minute. If you are experiencing numbness or pain or tingling in your hand, please stop, because that means you are compressing your median nerve and you may have carpal tunnel syndrome. Another test you can do is called the Tunnel's test. You're going to hold up the hand that you're experiencing the pain, and with your other hand, you're going to tap on the carpal tunnel, just very lightly. If you experience numbness, pain, or tingling in your hand, then that may be a sign of carpal tunnel syndrome. One more test that you can do is the compression test. You're going to go ahead and grab your thumb from your other hand and place it on the carpal tunnel and hold it down. If you happen to experience numbness, pain, or tingling in your hand, then you may have carpal tunnel syndrome. Just make sure to check in with your physician or physical therapist to see if you do have carpal tunnel syndrome, because often carpal tunnel syndrome is misdiagnosed, and it could be caused from compression of your median nerve coming from your neck, brachial plexus, shoulders, or even your elbows. There's a few things you do want to think about if you do have carpal tunnel syndrome. One of them is you want to make sure that your wrist is nice and neutral. So pay attention if at work your wrist is maybe bent or extended while using the keyboard or the mouse. When you're sleeping, are your wrists curved in? And just kind of pay attention to what you're doing throughout the day. Okay, let's get started with our routine. First, we're going to warm up the wrist and do about 5 circles, wrist circles, just to kind of get all the tissues moving. Now go ahead and switch directions, and you just want to go nice and gentle. You don't want to do too fast or too aggressively. Okay, great. Now let's go ahead and move on to doing some self-massage to the carpal tunnel. So you're going to go ahead and you're just going to kind of move all of your tissues away. So remember that the median nerve comes right through the carpal tunnel there. So what you're doing is you're trying to open up the carpal tunnel so that you can get rid of any sort of compression that's going on the median nerve. And then you kind of want to get the other side. These are the thenar muscles, thumb muscles. There you go. And you can go ahead and work your way up the forearm, just kind of pulling all of that tissue to the side, okay? Work your way up. And if you start getting numbness, tingling, or pain, then you want to go ahead and stop, or you want to massage a little bit lighter, okay? And the median nerve, it comes straight down over here too, so you just want to pull all of those wrist flexor muscles, your forearm muscles, away so it can reduce the compression. The next stretch we're going to do is the wrist flexor stretch. You're going to hold your arm out, the arm in the hand that you're feeling the pain in, and you're going to grab your fingers here and gently pull your fingers backwards. So you should feel a stretch right over here on your wrist flexor muscles. You don't want to do it too much, because if it's starting to cause symptoms in your hands like pain and tingling, then you want to lay off a little bit. You might even want to just let your hand hang there and let gravity stretch out your hand. So you're gonna hold this stretch for about 30 seconds. Okay, so our next stretch, we're going to stretch out the other side and do a wrist extensor stretch. So you're just gonna go ahead and turn your arm around here, drop your hands down, and you're gonna pull your fingers towards you. So here, you're gonna be stretching the muscles right here, the wrist extensor muscles. And if the pressure of pulling your fingers back is too much and you're experiencing pain, tingling, or numbness, go ahead and just relax your pressure, or you can just let your hand hang there. Okay, great. So the next stretch we're gonna do, it's the carpal tunnel stretch, and I love this one. What you're gonna do is get your other hand and you're gonna pull your thumb back, and what that's going to do, it's gonna open up this carpal tunnel here. If that's a little bit weird for you to cross over like that, you can go ahead and go from underneath and pull your thumb down. You wanna hold that stretch for about 30 seconds. And that's relieving all of the pressure from the median nerve, opening up all the tissues in that carpal tunnel, giving you the break that your hand deserves. Our next exercise that we're going to do is called the chin tuck. And what you're going to do is you're going to bring your head back ever so slightly, and you're going to tuck your deep neck flexors right here. And then relax. And go ahead and tuck. You're going to do about 10 of these. And relax. We're going to do about 5 more of these. You should feel this in the front of your neck. You want to make sure that you're not hiking up your shoulders while you do this, but that you're very relaxed, and the only thing that's moving is your head going backwards. Let's do 2 more. Okay, and last one. Next, we're going to do scapular squeezes. And what that consists of, you're going to squeeze your scapula back, hold it, and relax. We're going to do this 10 times. This exercise, pretend like you're pinching a pencil in between your shoulder blades. And relax. So you can see a back view here. You're going to go ahead and pinch and relax. And just make sure you're not hiking up your shoulders like this, because then you're going to be working the wrong muscles. You want to make sure that you're using the middle trapezius, rhomboids, as well as the lower trapezius. Push back and relax. We're going to do about 4 more of these. Good. One trick that I like to do when I do these is pretending like I'm putting the scapulas into my back pockets, in the opposite back pockets, like a crisscross. That way I don't accidentally hike up my shoulders. So squeeze the shoulder blades down and back into your back pockets. Great. The next one, it's a combination of 3 exercises of the chin tuck, the scap squeezes, and the carpal tunnel stretch. And I call these ones the hand openers. So when you do this one, you're gonna go ahead, bring your chin back, squeeze your shoulder blades, and you're gonna go ahead and open up that carpal tunnel. You're gonna feel a nice stretch in your chest, your bicep, your forearms, and even in your wrist. I love this one because it's a complete opener of everything that could contribute to median nerve compression. So go ahead and let's do 10 of these. And just make sure if you're starting to feel some pain, you can go ahead and limit the range of motion. You can just do like a small little motion like that. And over time, you can gradually work yourself to a larger range. Or if you're feeling really good, go ahead and you can pull it all the way back and feel that stretch. Let's do about 4 more of these. And just make sure your neck doesn't accidentally droop forward, but you're holding your deep neck flexors nice and active, your neck nice and aligned, your chest open, and open up the thumbs. This one takes a lot of thinking. All right, we're all done. I highly recommend icing your wrist and forearm for 15 minutes after you finish the routine. It will help reduce inflammation and swelling. If you liked what you saw today, go ahead and subscribe to Vertical Movement PT. If you have any questions or requests on my next topic for my next video, go ahead and comment below. All right, until next time.